Good morning. Let's start our our new webinar. We are now celebrating National Neurodiagnostic Month. This is presented by Skokie Institute of Allied Health and Technology. I am Dr. Bella Kaiser. I'm the Executive Director. I also specialize in teaching different courses in our institution. Um, so a little bit of an introduction about our institution. Skokie Institute of Allied Health and Technology is a nonprofit education organization. We strive to provide our community with hand-on training and education. Our purpose is to lead these students to economic independence and entry-level positions. We are an online institution. We are student-centered and community-centered organization. Even though we are online, we still do provide students with online one-on-one conference, and it's done through either Zoom, it's either done through Zoom or through Google Hangouts. The purpose is to have the student familiarize with his instructor or her instructor and also be able to talk to them, communicate with them if they have any questions regarding their courses. Depending on the student's choice, these hangouts can be done every week until the end of the term, or maybe a few weeks until students feel that they need the help. And if they feel that they can now work independently, then we do not host the hangouts for that course. We are affordable and flexible, and we value our students and their career training more than anything. The fact that we are willing to talk to our students through Hangout and also through online conferences shows that we are very, very concerned about how our students are doing. We are currently enrolling for spring term. The spring term starts April 21st, and then spring 2 starts May 20. Our winter term has already started on February 25th, so you can register for our programs and receive a free tablet and save on tuition as we cover for certification fees and books. I forgot to mention on the slide that we are also WIOA approved. If you are a prospect or a student that is going through WIOA, we actually do cover the student's tuition. WIOA will cover your tuition, your certification fee, your books. Student only has to attend the classes and complete the program. And we also provide with online training programs that are at your flexibility of your time and schedule with one-on-one instructor training as well as on an LMS. So what makes us different? We are licensed by the Village of Glenview Business Office as well as Illinois Board of Higher Education, private business and vocational schools to provide with career training programs. We are student-centered and community-centered. We provide with many free webinars to educate our community and students. You can watch these webinars on our YouTube channel. This webinar that is being presented to you today will also be featured on YouTube. We have been awarded the Best Higher Education Institution for 2 consecutive years, 2017 to 2018, and we are in the Business Hall of Fame through Glenview Award Program. So this slide and webinar actually focuses on National Neurodiagnostic Week, which is April 14 to 20. So the Neurodiagnostic Week is an excellent opportunity to educate others, recruit new students to the profession, and to promote neurodiagnostic awareness in the community. It is also a great time to celebrate the individual accomplishment of neurodiagnostic technologists everywhere, because this is a field that is still growing and you don't see a lot of technicians and professionals in this field. We really highly motivate and we highly encourage students to take admission in this field. Neurodiagnostic professionals, they work to ensure the health of Americans, not only in their day-to-day practice, but also through advocacy, education, and research. This field requires a lot more research than it would have in any other field because brain disorders and spinal cord disorders and neurology disorders are still something that are being studied on. Many causes of death in a person due to brain disorders is still unknown. And the reason for that is because brain itself has a very complex system of its protection. During this week, hospitals, schools, and other institutions acknowledge the year-round efforts of their neurodiagnostic technicians that they have. So the mission of Neurodiagnostic Week per Asset, which is the American Society of Electro Neurodiagnostic Technicians, excuse me, is honor and thank the neurodiagnostic technicians and professionals, demonstrate the value of neurodiagnostic technicians in all healthcare settings, promote neurodiagnostics in the workplace, in the community, and increase awareness of neurological issues in all environment. Because a lot of our diseases are caused due to the main cause, it is actually due to brain disorders. The purpose is to increase awareness, to let people know that this type of diagnostics does exist, and there are professionals who will treat you and help you deal with your brain and spinal cord disorders. Our brain is complex. It controls everything. It controls our homeostasis. It controls our environment. It controls our body inside and outside environment. And therefore, a lot of the diseases that we have and we get are actually related to brain. Stress is one of the main things. Stress is very heavy on our brain and its portions, and it can cause our homeostasis inside our body to get disrupted. So, method of neurodiagnostics. So, neurodiagnostic technicians or techniques used are several, but for the sake of time, because we are short on time and this is a very vast topic, I do encourage our prospects to actually go on our website and take a look at our program. We are one of the few institutions that do offer this program. Um, we will basically talk a little bit about EEG and brain depth. So see the next slide where I'll show it to you in a few minutes where EEG is performed. So what is EEG? It's electroencephalogram, which measures the activity of large number of neurons. In other words, the population of neurons in our brain and their electrical activity. It was first recorded by Berger, in 1929. EEG is non-invasive, it's painless, it does not interfere much with human subjects' ability to move or perceive stimuli, and are relatively low cost. Electrodes, electrodes that we put on the person's brain measure voltage differences, which is actually called as microvolt, and traces are then recorded as a brain imaging or in the form of a recording. So you can see this is these are patients, and this is an EEG technician that is performing an EEG. This is an EEG on a kid, and you can see the recordings in the form of electrical patterns. So what does EEG indicates? You can see that the potentials are good indicators of global brain state. They often display rhythmic patterns at characteristic frequencies. One big use of EEG is also to diagnose brain death. If a patient is not responding, and you want to confirm if they are brain dead and there's no brain activity, and then there's no way of them coming back to life, EEG will confirm that. You can see the electrical patterns when a brain is excited, or in other words, the neurons inside the brain are excited, when they are relaxed, when you are drowsy, when you're asleep. So this kind of shows the rapid eye movement pattern. When you go on deep sleep, this is REM, and then when a person is in coma. So EEG is also, like I mentioned, used to measure brain death. So what is brain death? Brain death is the irreversible loss of brain function. Functions are clinically ascertainable, meaning you see the functions that you can say, yes, this is being interrupted or it's not taking place. So animation and respiration are brain functions, for example. Generation of electrical activity, cerebral blood circulation, metabolism, they are not brain functions. So if the patient is not breathing on their own, it's not, they're not um, responding to other stimulus, they are brain dead. But if there's generation of electrical activity, meaning electrical activity would be muscle activity or generation of heart electrical activity, there's circulation going on, there's metabolism going on, mean the person is on the bed, is bedridden and still producing urine, this is not brain function. A person who is brain dead is actually dead according to the US standards. However, you can, in case when the family is dealing with this patient, there are different accommodations that can be made in order to support the family. The time of death is that determination that is made when you do an apnea test and it comes out negative. And usually when the apnea test is negative, if the other brain tests that they perform are negative, normally you take the patient off of life support, patient will be considered dead. So diagnosis of brain death. So since we're talking a little bit about EEG, we would like to discuss a little bit about brain death. So what are the diagnoses? Cause of brain failure, which was irreversible. Patient is unresponsive. Brainstem reflexes are absent, meaning the brainstem is not responding. Brainstem controls our respiration, it controls our eye pupillary action of our eye, and if you do not see that in a patient, the patient is considered to be brain dead. Apnea test shows no breathing. Laboratory tests normally are not required until there's something clinical that you're looking for, like the amount of carbon dioxide in the blood, as compared to oxygen in the blood, because there's a certain amount of carbon dioxide that the brain will permit, and then at that point it will start to breathe on, the person should start to breathe on its own. But if the amount of carbon dioxide keeps on increasing without any action, that means the patient is brain dead. Causes of brain death. Most brain deaths, they occur from severe brain trauma. It can be anything. Stroke, which is massive stroke, usually hemorrhage. Prolonged cardiac arrest. The heart stopped working for some reason and they were being revived and there was no oxygen supplied to the brain. Sufficient time has elapsed to ensure irreversibly, usually after cardiac arrest, 6 hours the most. If there's no action seen after 6 hours, that means the person can now be considered that brain dead. So this was a little webinar that we just wanted to communicate to the community regarding our program, and also important, and also celebrating National Neurodiagnostic Week. If Why are we talking about this? What is our relationship? Well, because SIAHT has programs in fitness trainer, nutrition wellness coach, and allied health. One of our allied health program includes Neurophysiology Technician. Our program is 10 months long and prepares the students in the program about neurophysiology techniques and how to assist neurophysiologists in making a diagnosis for brain and spinal cord disorders. Students learn about the medical terminology, brain anatomy, neurophysiology principles in handling patients with brain and spinal cord disorders, and techniques that are used to perform intraoperative neurophysiology monitoring. Students are required to complete clinicals that are 2 terms with total hours of 150 to 160. And once students graduate, they are eligible to sit for the Abbotsingh exam and credential. So it's a view of our website. This is a small view. Our website has all the information the student needs, and they can contact us at admin@siaht.org. You can also call us at 847-461-3985. You can also visit us in person by making an appointment. We do have our contact forms on our website that can be used to request an appointment. We are also on social media. So you can follow us on Twitter, Facebook, YouTube, Instagram, LinkedIn. We are on Google Business. Like us and get all our updates and notifications for Health Awareness Months. You can find the links on our website. So I hope you enjoyed this small webinar. Our purpose was strictly to celebrate one of our programs that we offer to our community and students, and also recognize neurodiagnostic technicians in their field of career. We will be back next month or in the month of April, depending on what next health awareness month, awareness week or day we will be celebrating. We'll provide you with a small webinar to educate you for that. Have a nice week. This is Dr. Bella Kaiser, Executive Director of Skokie Institute of Allied Health and Technology, signing off.